Taoiseach, I am very strongly of the view that the vaccination programme is key to actually getting us out of this grim pandemic situation and reopening society. But in that context, I believe the legislation you're pushing through is actually very, very damaging and divisive. It's a gift to those who are anti-vax, and even civil liberties groups like the ICCL have warned that it raises very profound questions about discrimination, about the ethics of demanding medical or health information from people. And in fact, they wrote to you, I think, to the effect that they said is smacked of mandatory vaccine insofar as you're denying entry to people who, for example, have health conditions where they can't be vaccinated, haven't been vaccinated yet, or have not been entirely convinced of the efficacy of vaccines. And it's very important to say the World Health Organization has consistently opposed anything that smacks of mandatory vaccination as threatening to undermine the vaccination program. So I think it's very, very divisive. It causes problems that could undermine the public health effort, and of course it threatens the health of young workers who are going to have to work in hospitality when they are unvaccinated.
Just say generally, in response to this issue, that there are choices facing government and facing the Oireachtas. We can decide not to open indoor hospitality at all. That's a decision we can take. Is that what people want us to do? If so, please articulate that. I think Deputy Murphy's of a view that we shouldn't. I think he's been straight about it. I don't know what Deputy Boybart's view on it is. I don't know what delay means. Do we do it or delay until vaccination? Fine. NPHET are of the view that if we restrict it with a verifiable and enforcement approach to the vaccinated and to those who've recovered from COVID, that's a safe way of doing it. And that's what the legislation reflects. So we're doing this in the context of public health advice. Now, public health advice did not reference children. Take that point. But the children will be part of a family bubble. They will be part of a family bubble in terms of dining out. They can't be drinking for obvious reasons, given age, in a pub, but they will be in a family bubble. And it's in line with public health advice. Sorry, not that in terms of the issue of the vaccinated and the recovery from vaccination. That's all has been proceeded with in the first phase of this reopening of indoor dining and indoor hospitality. And there is no desire to be divisive at all, but there is a desire to protect. That is the only issue here in terms of not allowing the unvaccinated indoors. It's not about mandatory vaccination, nothing to do with that. We have managed outdoor hospitality well since we've reopened it. And it's gone well, insofar as it can go. The next phase will be more challenging and more difficult. I do not underestimate the Delta variant. I think it's very serious. But we're not similar to where we were prior to Christmas, because we have substantial vaccination achieved already, both in first doses and in terms of people who are fully vaccinated. And this is about balance, and there are risks involved. It will require vigilance. It will require adherence on the part of all of us. It will involve personal responsibility to adhere to the law, to adhere to the basic principle of if I'm vaccinated, I can go indoors. If I've recovered from COVID, I can go indoors. That's very, very important here to facilitate this latest phase of the reopening of our economy and of our society. And I think it is about balance, and it's in line. And in terms of workers, it's also about protecting workers in terms of the Chief Medical Officer has been very clear that they will obviously have protections, but also it will be a vaccinated cohort of people that they will be serving, which significantly gives obviously added protection.
Thank you, Taoiseach. That brings us to the end of Taoiseach's questions.
In respect of long COVID, that's a very serious issue which I take very seriously, and we do need to follow through and do some more research in terms of the number of people who could get long COVID and the long-term implications.
I'm afraid the time is up.